I think that one of the things we're seeing is people coming together in ways that we've never had to before, frankly.
Governor Whitmer, it's good to see you. How are you doing?
Thank you. I'm fine. I'm hanging in. I am, these are challenging times. We're asking a lot of people to make sacrifice. And even on the hardest days, as we see the death toll continue to rise and we see the positives continue to climb, there are sources of inspiration. The true superheroes out there that are on the front line in our hospitals and getting food to people, it's really heartening, and I take inspiration from it.
A lot of people have been asking me, the governor is out there, she's talking to a lot of people. How is she keeping herself healthy, and what kind of precautions are you taking? Because I think we all look for an example.
Yeah, so it's that line between making sure that people see that we are on the ground, we are working 24/7, and also making sure that my team and we're all practicing what we preach. So right now I am coming to you from the Lansing residence. This is the library. You can see a little bit behind me, and we've taken down any big events. We're being very, we're practicing what we preach, and so I don't go to out when I don't need to go out, but tomorrow, I would anticipate getting down to TCF. We've got people coming in from the feds to talk about the site that we're setting up. And so there are instances where I need to, and we just are very careful.
Well, let's go ahead and start talking about that. A 900-bed field hospital at the TCF Center. What about staffing there? Can you give us any more details about when it will be up and running and filling those positions?
Well, I think that one of the things we're seeing is people coming together in ways that we've never had to before, frankly. I was on the phone yesterday with CEOs of all of the major hospital systems in Southeast Michigan, talking about this very issue. Of course, we're stressed. We have to make sure that the White House and the Canadian governance doesn't change border crossing rules, because we have so many healthcare providers who come over every day into the metropolitan Detroit area. We have to make sure that we're working with our hospitals to supplement the kind of work that's going to be needed there, but also over in TCF. And we're pulling out all the steps. We are asking people who've retired in healthcare to consider coming back and joining the front lines. We've asked people from outstate who don't have the kind of numbers that we do in metropolitan Detroit to come into Southeast Michigan. And we're inviting people in from all walks across state lines, because this has to be all hands on deck. And we are a hot spot right now, and we need all the help we can get.
Yeah, you said we're a hot spot in Michigan, but also specifically looking at Detroit, and now we're seeing a couple pockets in Oakland County. Is there anything that you can say that in talking with the medical professionals, if there is pinpointing a reason why we're seeing the outstanding number of cases in the city of Detroit, and is there any sort of change in strategy in dealing with it?
So, Dr. Janae Caldoun is our chief medical executive, and she is fantastic. And she's been asked this question many times. And while I'm not the doctor, I'll tell you what she says, that higher instances of poverty create, the kind of environment where you see this rapid growth. When people are less healthy, they succumb to COVID-19 symptoms in worse ways than an otherwise healthy person. Access to good quality healthcare, access to good quality food, the rate of diabetes. These are all pieces of the equation that has contributed to this exponential growth that we're seeing in big cities, but in Detroit in particular. It's precisely why we have to learn a lesson from this about ensuring there really is equitable access to skills opportunities and equitable access to feeding your family. These are all important pieces to living a good life that so many take for granted, but that are the fundamentals that we see right now playing out, that poverty is a pre-existing condition. And this is why all our policies need to be focusing on pulling people, giving people paths out of poverty.
Let's talk a little bit about a report that came out last night that details some specifics about what was reported as your plan to end the school year. Can you comment on that report, and either can you confirm it or talk about what the decisions that are going to be made about the school year?
Well, I'm not going to confirm it. We're not finished. I haven't made decisions, and that's, I think, why you saw such a strong reaction from my communications director. There is a lot of conversation being had, and we're being very inclusive. We're having conversations with the partners in the legislature, with the Michigan Department of Education, with our superintendents and teachers on the ground who are actually the true experts in education. We're fashioning a solution, but remember, we are a huge state. We have 1.5 million kids who are school-age population, and it is important that we get this right. I've got 2 kids as well. I know you've got Catherine, who's in 5th grade sitting, how old is Catherine, 15?
5th grade. No, she's sitting right there.
And I've got
2 more. This is the hazards of doing your work from home.
Right. And there's the upside too, right? Yeah. So, but we got to get this right. And every school district has different challenges. Every school district has different resources. If we could simply flip a switch and say we all go to online learning, that would be wonderful. But the fact of the matter is, there are schools that don't have these type of resources, and that's what complicates our ability to meet the needs of all of our kids. But that's precisely why we're doing the hard work now, so that when we announce it, which may be tomorrow, probably more likely on Thursday, we will have had the ability to take all these pieces into consideration so we can get it right.
Yeah, I talked to Dr. Nikolai Vitti just yesterday afternoon, and he was making the case for why the school year should end right now. And again, coming at it from a very different perspective than someone who will be coming from the UP or from the northern parts of the states. Can you talk about what the differences of opinion are between educators in different parts of the states and the strategy behind what could happen for the rest of the year?
I think right now, one of the things that we know is that people in metropolitan Detroit are seeing the severity of this crisis. When you get a little further out state, it's not hitting at home as hard right now. We know that there's not a part of our state that's going to avoid COVID-19. What we can do is mitigate how many people get sick and save lives in the process. And so that's precisely why we've been so aggressive. We were one of the first states to pull our kids out of school. It was not an easy decision to make when half of our children qualify for free or reduced lunch. That means 750,000 kids get their meals at school. We've worked with our districts. We've worked with the National Guard to make sure that we're able to provide these meals. But each one of these decisions has repercussions, and that's why it weighs heavily. That's why we are very thoughtful. We're moving quickly, but it has to be done right. That's paramount.
Lastly, let's talk a little bit about the economy. People are trying to file for unemployment, a little frustration with the process, the state. What can you tell them?
So just hang in there, keep trying to file. Our system has stayed up where others have crashed, but is undergoing enormous pressure because how many people are out of work. I have relaxed some of the rules so that if you get your unemployment application filled out and it's not on the usual time frame, you won't pay a penalty for that. If you are not able to get all the usual documents that we would generally require from an employer, that won't stand in your way either. We're going to work with people to make sure that those who are unemployed get the kind of support that they need. And it can be frustrated on top of all the stress of being out of work and being home and seeing bills coming due. But we are working incredibly hard to make sure that people have the support they need.
Again, it feels like a lifetime has gone by in just a week or so. We're going to continue to be in communication with you. Thanks, Governor Whitmer, for the time, and be well.
Thank you, Christy. Be well. Bye, Catherine.
We'll see you soon.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.